Well, South Africa has received about 520 million rand from the Global Fund to fight AIDS, TB and malaria. The money is set to be used to buy the twice-a-year anti-HIV jab, that's lenacapavir. The jab has shown 100% efficacy in preventing getting the disease. It could potentially aid AIDS as a public health threat by 2032. But the Becky Caesar Center for Health Journalism says the money is simply not enough. Let's unpack this now with this editor-in-chief, Malan. She's the expert on this. Mia, good afternoon, and thanks so much for your time this afternoon. And yes, please do make sense of it for us. It sounds like good news on the other hand that we're getting this money, but what's the snag?
So the snag is that it's not new money. It's Global Fund money that we got awarded for HIV work in South Africa. And now the Global Fund has given us permission to use some of that money to buy lenacapavir, which is the anti-HIV jab that you take once every 6 months. So it's not bad news, but in the bigger context of things, if you look at what lenacapavir can do for South Africa, there are modeling studies that show that if we give it between 2 and 4 million between 2 and 4 million people each year between now and 2032, then we can end AIDS as a public health threat in the country. Now, the money that we got is just enough to put 400,000 people on lenacapavir for over a 3-year period.
So it's not money that's going to go far enough, Mia, but who makes up the Global Fund to fight AIDS, TB and malaria? Any chance that the US can or might still contribute?
Well, that is a very unclear situation at the moment. So the US, the Global Fund is funded by richer countries, by the governments of richer countries. And up until before the Trump administration started, the rule was that the US it was the largest funder of the Global Fund, and that it will give $2 for every $1 that other countries give. Now it will definitely give less. There's a budget that President Trump submitted to Congress, and it looks like he doesn't want to give as much money. We're waiting for Congress, of course, to see what they will say. But what is also happening is in December last year, the AIDS program of the US government called PEPFAR, that's a program that gives money to AIDS projects in countries like South Africa. They announced with the Global Fund that they will fund lenacapavir rollout in countries like South Africa. And it looks like they're not on board at the moment. They haven't made a formal announcement, but the announcement that the Global Fund made about the money that they will give to countries was made alone. It was no longer made with PEPFAR. So there is a big question about what will happen to that contribution of PEPFAR. And we must remember there are rules, a limited waiver for PEPFAR that President Trump did announce earlier this year. And what that comes down to is when it comes to things like lenacapavir, so medication that you can give to people to prevent them from contracting HIV, those rules, those waiver rules say the US government will only pay for it if it's given to pregnant women and breastfeeding women to stop them from infecting babies. They won't give it to any other groups. And that limits severely how that money can be used.
And just reading further into your article, Amir, I mean, it seems like the pricing of this jab, there is an issue around there. There seems to be a little bit of a secret. Are we talking big pharma at play here? And maybe that has something to do with it.
It's a really complex situation. I don't think it has something to do with whether PEPFAR will come on board or not, but it does have bigger implications for transparency. So what's happening is this lenacapavir jab is new for HIV prevention. It's been used for treatment before, but this is different when you use it for HIV-negative people to stop them from getting infections. So the only country in which it's been registered so far is the United States, and it's sold there for $28,000 per year. So that's just over 500,000 rands for 2 injections a year. Now, it's very common to have tiered pricing when it comes to medicines around the world. You'll pay a lot more for it in America than here. But now in Africa, there's no way that we can afford those prices. So the rumored price that the company that makes lenacapavir, it's Gilead Sciences, that they sell this medicine to the Global Fund for is $100 per year compared to the $28,000 a year that it's sold for in the US. But they don't want to make the price public because they argue they're giving it at a profit price, not for profit price. So that means that they're giving it at the cost that it costs them to manufacture it. And they argue that they've never revealed, the cost of prices that it costs them to manufacture. And so the South African government, the health department, is really not happy with that, because what's happening in the contract that they have with the Global Fund is they've been told to budget for $60 per patient per year, but that's not the real price that the Global Fund buys it for. They've been told budget for that, and if there's a difference between the price that the Global Fund pays Gilead Sciences and the $60, the Global Fund will use other money to pay that difference. We won't know how much the difference is.
Yeah.
And the health department feels it's not transparent.
Well, the article also says that SAHPRA told you, Becky Cisa, that it's aiming to have lenacapavir registered in South Africa before the end of the year. I mean, how likely is that?
No, I think it's very likely. So, SAHPRA is a competent body, and they are part of an application that will make it faster for them to register it. That is part of the European Medicines Agency, a branch of it that helps countries like South Africa. And once that registration from the EMA, the European Medicines Agency, is expected around August, September. And then SAHPRA just needs to do a few local things on this side to register it here. And I trust that it will get registered then. And the health department at a recent HIV conference in Kigali that I attended last week made a presentation that said that they plan to start with the actual rollout in March, April next year.
So what is the actual process when that happens then, Mia? Because I believe there are grant cycles that come into play.
Yes, and it's actually not just the grants, that the money will become available in October. And the Global Fund said they will be able to ship lenacapavir to at least one African country before the end of the year. Our health minister said in his health budget vote speech 2 weeks ago he wants South Africa to be the first country. But that doesn't mean we can start with rollout. Because to roll it out, you need to get health workers trained on how to administer this drug. You need to be able to deliver or transport the medicine safely, and need to work out which facilities need to get it. Our health department actually has got a pretty good system in place that they use data to know where people would have the biggest need for it. But more importantly, it doesn't mean because we have this injection that people will actually use it. We need to make them aware of it, and that will take time. And just in that context, we've had a daily poll for free at most of our public health facilities, but you have to take it once every day to be able to prevent, to have it effectively prevent HIV infection. And that poll hasn't gained enough traction. So the lesson we need to learn from that is we need to do a lot of what experts call demand creation, so make people aware of it and aware of the HIV risk before we can start to roll it out.
All right, and just to wrap it up, and given everything that you've said, Mia, I mean, this 520 million rand from the Global Fund to fight AIDS, just how useful is it actually really going to be to us? How far is it going to go?
It's very hard to tell. We know in terms of numbers, it's enough for 400,000 people on lenacapavir over a 3-year period. It's not nearly what we need, but it is most certainly a start. And we would hope that as generic companies come on board in 2027, that the price would get low enough so that the health department is able to buy more doses from Treasury funds.
All right, Mia Malan from the Becky Cisa Center for Health Journalism. Thanks so much for breaking that down for us.